Hey guys, welcome back to my channel. If you're new to my channel, then hi, I'm Monisha. I'm originally from India. In the year 2018, I passed my PLAB exams and I moved to England. I'm currently co-trainee year 1 in specialty psychiatry in London. If you're somebody who wants to follow the PLAB pathway or wants to figure out how to get into UK after attaining your medical license, then I will link up a few links up above here and also put down a playlist down in my description box. So today's video is yet another most requested video by you guys. You guys wanted to see and know how to make your portfolio for getting into training, how I got into training. So I decided I'll put all of those questions in one place. So in today's video, I'm going to be discussing my own timelines about how and when I applied and how I got into training. I will be featuring my portfolio. So this is my portfolio that I took with me when I went for specialty training interview last year. There are a few of the tags that have come off, but regardless, I'm going to show it to you in its entirety and let you know what all I put in and how long I took to make my portfolio. So the application window opens up a couple of times in the year. I can't be telling you when it's going to open next because the announcement is already out on the website. According to the official website, the application window for 2021 intake, that means for you to begin your training in 2021, that's August 2021, opens on November 5th, 2020. So your window to apply for training in psychiatry will open on November 5th, 2020, and the window will be open from 5th November till 1st of December. So you have to go to the website, that is Oriel. Oriel is the one place where you apply for all specialty trainings. It's not just psychiatry. Any other specialty in UK, you go to Oriel to apply. I'll link down below all the websites that I'm mentioning so you don't have to go and look for it. So basically, there are 3 times when they have intake of trainees in specialty training. That is round 1, then there's a round 2, and then there's round 2 re-advert. Round 1 is when it's advertised and people apply, they give the exam and the interview and they begin their specialty training in August. So a couple of slots are not filled by trainees, or few of them give up or don't want to do training or for whatever reasons. So those slots are then re-advertised for training posts for round 2, and then if there's any further slots that are remaining, then it would be again round 2 re-advert. Currently what they have advertised is for round 1 specialty training. So you would be applying now in between November and December. You will do your application, then you would give the exam. I will talk about it further down in the video, and then you'll give your interview, and then you begin your training in August 2021. For you to begin in February 2021, it's already closed. So the trainees who are beginning in February 2021, they already get to know they've gone through this process much earlier in the year. So now you know if you're interested in applying for psychiatry, then you should bookmark your date, November 5th. You can apply for your specialty training. Okay, so next up is eligibility criteria. So there are a bunch of checklists or tick boxes that you need to tick before you are considered to be eligible to be applying for specialty training. I've got it up over here. I'll put down the link of the website down below. So it's on the website specialtytraining.hee, which is healtheducationengland.nhs.uk. So I'll read out a few of the eligibility criteria which you need to meet to be eligible to be applying for specialty training in psychiatry. Number 1, you obviously need to have done or finished your MBBS, so you need to have your primary medical qualification. You need to have 12 months of medical experience after full GMC registration. You need to have fitness to practice. There are a few safety needs that you need to tick off. Language skills, you need to have cleared your IELTS or UKVI IELTS to be eligible. You need to meet the health requirements. You must be able to show complete proof of your employment history and how you've progressed in your career. And if there's been any inconsistency, then you need to have some proof. Or if you've worked also in UK, then you should be having an outcome of your appraisal. It's academic skills, that's research and audit skills. Personal skills, that's communication skills, judgment and problem solving. So there are a bunch of things that you need to fulfill before you apply for your specialty training. So there's essential criteria, then there's desirable criteria and how they're going to evaluate it. There's no point of me reading out what all is written up on the website. You can read it by yourself. I will show you my own portfolio, how I met these requirements. Yeah, things like that, like teaching and learning. I'll explain all of that to you when I show you my portfolio. This is the eligibility criteria. You need to meet these certain checklists before you apply for your specialty training. For people like us who are IMGs, that is international medical graduates, because we haven't done our F2 over here, that is FY2 foundation year 2, we need to get a document signed off to prove that we have done our training FY2 equivalent to somebody somebody who's done their foundation year 2 training over here. There are a lot of names to that. It's called readiness to enter specialty training, or alternate competency form, or alternate FY2 form, or the CREST form. I link down below the form again. Mind you, the form changes every year. So if you've gotten the form signed off in 2019, it's not eligible for you to be applying in 2021 or in 2020. So for you to be applying for specialty training next year, there is a fresh form that comes out. They add or subtract a few of the criterias. I'll link it down in the description box. I'll show you the form I got signed off last year. At that point, audit wasn't necessary. Regardless, I did an audit anyway because it was one of the requirements for applying for specialty training. It wasn't a requirement to get my CREST form signed off or my FY2 form signed off, but it was necessary for me to apply for specialty training. So I did one anyway, and I would advise you to do one as well. It's basically a documented proof to show that you have done foundation year 2 training equivalent to a trainee from here or a medical student from here. It is to be signed off by a consultant only, and by that I don't mean an associate specialist or a consultant who is from another country but is not on the consultant registrar. It has to be a GMC registered consultant from here for it to get signed off. Oriel website, you apply for the specialty training, you upload this form, you write in all the requirements that's needed, you fill in all the boxes of your name and your details and your GMC registration number and all of that. After that, if you meet all of the criteria, then your application gets approved, and then you're sent a link to book an exam, which is the MSRA exam, which is the multi-specialty recruitment assessment exam. So it's an MCQ exam. The following specialties are the specialties which need to apply for MSRA exam to be then sitting the specialty training interview. So the specialties are GP, radiology, psychiatry, obs and gynae, ophthalmology, neurosurgery, child and adolescent mental health services, community sexual and reproductive healthcare. So all of these specialties have to sit the MSRA exam to be applying for core training or specialty training. So it has two parts, all right? Clinical bit and the SJTs, which is situational judgment test. So the first bit, which is the clinical bit, you have all clinical scenarios and clinical questions. It's not concentrated only on psychiatry. It has questions from all specialties. There are 97 MCQs, that is 97 multiple choice questions. You have to finish them in 75 minutes. You have got two patterns of those clinical questions. So that one is single best answer and the next one is extended matching answer. These are the various specialties or the various subjects on which you're going to be asked questions in your clinical bit of the MSRA exam. That is cardiovascular system, dermatology, ENT, eyes, endocrinology, metabolic disorders, gastroenterology, nutrition, infectious diseases, hematology, immunology, allergies, genetics, musculoskeletal, pediatrics, pharmacology, psychiatry, neurology, renal, urology, reproductive, respiratory. So all of these systems and subjects are going to be forming your part 1 of the paper, which is the clinical bit of MSRA exam. Then you have a 5 minutes break, and then you have the situational judgment test, which are basically, they deal with professional dilemma questions. So that is 50 questions in 95 minutes. They are ethical scenarios. Believe me, time flies because the questions are so massive, as in they're like, the whole scenario is one paragraph long and you're like, what would I do, what would I not do, and you think so much, time flies. 95 minutes are way too less for 50 questions. So the cost of MSRA exam is free. So it's a free exam. You need to basically just be eligible. The application needs to be accepted and you can book the exam and give the MSRA exam. There is a catch over here. So if you score 550, that is the situational judgment test and the clinical scenarios or the clinical bit of the exam, both of them combined, if you score more than 550, you do not have to sit the interview. You basically surpass the interview and you're directly made an offer for specialty training. You get to choose which city you want to do your specialty training in, which trust you want to do. So you're given an upper hand, and there are very few people who score more than 550. Is it doable? Yes. It's not impossible at all. But did I score more than 550? No, I did not. I had to sit the interview. Then you have the interview. If you do not get more than 550, you have to go for the interview. So ultimately, your national rank is based on the MSRA exam plus the situational judgment test plus your interview score. So all of those three combined, you get an overall national all UK rank. The interview happens in Manchester in Etihad Stadium. Don't ask me why all the specialty interviews happen in different football club stadiums. So the interview is again divided into two parts. One, you have an OSCE exam where there's a big patient and you have to assess the patient and obviously you're marked. There are two psychiatrists sitting there and they are going to see how you perform, what you do, and you're marked over there. And then you have the portfolio station where you have your physical portfolio and you are asked to show, proofs and certificates of things. The first one, which is the OSCE station, which is where you have a patient of alcohol dependency. Yes, you already would know what the scenario is going to be. A week in advance, they let you know what will be the scenario, what is the patient going to present with and what is expected out of you. So basically, it's a patient with alcohol dependency and who was supposed to have a minor operation on his knee, and because his LFTs are deranged, his procedure gets cancelled. So you have to go and break the news to the patient that we did a prior blood test for you and the LFTs are deranged, and the surgeon has unfortunately decided to not go ahead with the procedure. And you have to then explore the bit about alcohol, his alcohol dependency bit and all of that. The patient can present a little hostile and be pissed off in the sense that, hello, I came in for my procedure and why are you talking about my liver function tests over here, and exploring about how much I drink and I don't drink and all of that. Yeah, it's a 15-minute station. They basically want to see how calm and composed you can be and if you can, basically explore the whole alcohol dependency bit without pushing the patient too far. Patient will not try to engage much with you because the patient came for other reasons and is now sitting there answering questions about alcohol. They want to see basically communication skills and how you handle the scenario and how calmly you explain to the patient that, this is something that's reversible. It's not like, just because your procedure is cancelled today, it's never going to happen. We can reverse it. So basically, they want to see how well you can handle the scenario. Then you go on to another room where you have your portfolio station. You're given 15 minutes. So this is something that I actually got a tip from someone else and I read about it in a lot of people's blogs. What I did was, I know this might sound ridiculous, but believe me, it did work. I made a whole script where I would tell, like a whole story about, my journey, about how I started and what exams I gave and what I did in India, and then I moved here while showing my portfolio and my certificates and everything. There was a nice consistent flow in the way I told the story. I didn't keep it like, I was telling a speech or something. I kept it obviously a little light and nice. By the end of like 12 minutes, when I was done showing my whole portfolio, there were only a couple of minutes remaining and they really had no questions to ask me because I had covered it all. Instead of them saying, oh, can you show us if you did this, if you did that, I had basically told everything while flipping the pages of my portfolio and showing them all of it. So I started my job as a non-trainee in Southend in January. I had no intentions of applying for specialty training for February 2020 intake. I actually wanted to start my specialty training in August 2020. But my consultant from Southend was really lovely, and he told me, you have nothing to lose. Why don't you just apply? If you get rejected, you get rejected. At least you would have experience of having applied for it. I was like, okay, I'll think about it. I already had a discussion with him within a month of me joining the job that I'm not interested in medicine. I want to do psychiatry. So he made sure that, I did projects, even if I was in medicine, related to psychiatry. And I'll explain to you how and why and all that. But then March came and I had a personal loss and I lost a loved one and I got a little sidetracked, and fairly so. When I came back to UK in April, my consultant was very supportive and he told me that, just do it. If you get rejected, you get rejected. There's no harm in applying for it. So I had May, June, July, August. I had 4 months to do a year-long portfolio bits. And was it doable? Yes, it was in hindsight because I did it. So I'm going to show you my portfolio, what all I did. So this was my portfolio. I got this folder or binder from Wilco. I think the tag is still there. I wrote my name and I put up my GMC number over here. So the first bit I've written is GMC. So I've got my GMC license. Then I wrote here competency. So basically this is the certificate of readiness to enter specialty training. Read it out to you guys, what all it says. So this is the specialty training certificate which I got signed from my consultant in Southend to say that, even if I haven't done my foundation training from UK, I'm working here and I meet the criteria and the competencies of a UK medical graduate or someone who's done their medical school from here. And then I've got documents from my medical college in India. So this is my MBBS certificate that I've done my MBBS. Then I added all my years of how much marks I got in each year, saying that I've passed my final MBBS from India. This was 1 year compulsory rotatory internship that I did in India after my MBBS. So all the specialties that I was rotated through, so it all adds up to 365 days. Then certificate of finishing my internship in India. Then this is the Maharashtra Medical Council. This is basically my medical license in India that I'm registered with a state body there. there, which is MMC, Maharashtra Medical Council. Then this was the British Council, basically me clearing my IELTS. So my IELTS certificate. These are all basically documents, all the certificates. I did not do a post-graduation in India because I was preparing for post-graduation exams. I kept all my admit cards. So I gave DNB and NEET PG in 2017, so all of that. Then I told them that, you know, I'm currently working in Southend. I added my certificate of employment from Southend University Hospital. Then I added a brief CV. One thing that I did is that when I went to the portfolio station, I had printed a bunch of my CVs, very concise and precise, just one page, one A4 size page, printed 5 of them. I did not know how many people are going to be sitting in the room. So the moment I walked in, even if I had this whole thick folder or binder of all my certificates, basically my whole CV, but I had them done in a very concise form on those A4 size pages, and I gave it to them before I sat down, saying that, you know, these are like brief bits of whatever I'm going to talk in the next 12 to 15 minutes. It looks very professional if you do it as well. Then they had PDP, which is basically your professional development plan. What all I had planned for 2019, okay, when I joined Southend. So I told them that I will work towards getting my FY2 competency form signed off. I'll attend courses and conferences. I said I would appear for MSRA exams to enter for specialty training. I was like, whether I fail or not, I just said I'll appear for it. And I said I'll do a few teachings in my department. This was my appraisal form. If you're a non-trainee, then you have yearly appraisals. You have to sit through with a consultant who doesn't know you. It's from another department altogether. And then they go through things you've done over the span of 1 year, and you need to get some CPD points. And basically you must have attended courses, you must have done teachings, attended lectures, you must have gotten an entire well-rounded feedback from your department, and it's an anonymous feedback. QI audit. So I did an audit in my department with another colleague of mine. So it was on neck of femur admissions, the number of neck of femur patients that got readmitted over a span of 3 months. I also got email to say that I had updated the hip fracture guidelines of the department with my consultant, and also I updated the junior doctors, the guidebook that I made, so that, you know, whenever junior doctors came in, they were updated with what's expected out of them and how the department works and all that. Also, I updated the guidance for discharge summaries for the neck of femur patients in the departments. So I did that as well. Then teaching. So I did a few presentations and teachings in my department. Like I had mentioned, I made sure it was a lot more centered around psychiatry. I did a case presentation on meningoencephalitis. We had a patient on that. I also attached feedback forms which were from consultants, registrars, and my colleagues who were junior doctors. Then I did another on cemented versus cementless joint prosthesis, because we work closely with trauma and orthopedic department. So I did one on that as well. And I did one more presentation on post-op delirium plus case presentation. So I spoke a lot more about haloperidol and how it's used and all that in this presentation. Next bit was learning. So in learning, even if I was a non-trainee and it wasn't expected out of me, my consultant was really nice. So he made sure, more than I did, that I attended a lot of F2 teachings. It was compulsory for foundation year doctors to attend, but I made sure I attended all of them because obviously I wanted to learn, but I also knew that it's going to work towards my portfolio. I also attended medical grand route teachings, did that as well, got my attendance for that. Then, you know, the compulsory training that you need to do while you're working in a trust in NHS, you know, all the induction bits, initial meeting with my supervisor, my educational and clinical supervisor were the same person. He was really nice. So I did a bunch of case-based discussions with him, got that signed off on my portfolio, e-portfolio, and then printed them off. A few more of case-based discussions. I did basically 5 case-based discussions. Then I did a few mini kicks, which is basically mini clinical evaluation exercises. If a new patient came in, he would be the one observing, and I would take all the history and do the examination and everything, and then he would give me a feedback on things that I missed or things I should do better the next time. So I got it all signed off electronically on my e-portfolio, then I got them printed. I keep mentioning e-portfolio, and you will ask me what is e-portfolio. Basically, there is something called Horus e-portfolio. Non-trainees have to pay for it. I got mine for free actually because my consultant was so nice. So he emailed to the medical education department saying that I'm a new FY2 equivalent, and yeah, so I got my portfolio for free and I used it for a year, and before I left the trust, I got all of those bits printed off. Then I did the AHA, American Heart Association, ALS and BLS courses. So ALS, BLS certified from India before I came in. Then I came in and it wasn't valid here because they follow European guidelines. So then I did the one from Resuscitation Council UK. Then I attended a hip fracture summit in London. So got that certificate. Then I attended one conference by Royal College of Psychiatrists. It was Foundation Training Conference London. It was Medicine for the Curious. I also got observership in psychiatry booked in Rochford Hospital near Southend. So I got the 1 week observership in psychiatry to show that I'm keenly interested in psychiatry. So yeah, so the most important thing that they practice here in UK is reflective medicine. You write down a lot of things about, you know, if you've learned something new, or if you think you could have done something differently, you've come across a difficult situation, you write it in your e-portfolio. So I did a lot of reflections on things that I learned new. I wasn't aware of something, or if I had a tough encounter with a patient or with a nurse or somebody. So you basically reflect on what happened. How did you feel about it? How do you feel about it right now? Going back to the incident, would you have done something differently? Do you learn something from it? So yeah, so that's reflective practice. So you are expected to do lots and lots of reflections while you're practicing medicine here. Then I had the mid-year review progress with my consultant. So it was 6 months into me working. I had to get a mid-year review or progress with him. So it was my final sign-off. Then this was from my trust saying that, touchwood, I was not registered in any serious incidents, and in the period that I was working there were no complaints against me. Then comes the exciting bit, extracurricular. So I added things like I participated in a lot of debate competitions while I was in medical college, the prizes I got in debate competitions, and a few presentations I did while I was studying in my medical college in India. Then in the gynecology case discussion I was involved in, a few conferences I did with my mom actually, so got a few certificates there. And I showed them that I'm a trained classical dancer. I've learned Kuchipudi, which is an Indian classical dance form, for a very long time, nearly 7.5 years. Then I show them I doodle sometimes, I like to paint, so I put in a few of my paintings and artworks in there. And then I put up about my Instagram page saying that I love to document my traveling bits and my life and all of that. And now I'm actually doing things differently, and I'm putting out more about my IMG journey, and I hope it helps you guys. But yeah, so this was my Instagram bit. It was my Instagram page, so a few of the aesthetics from my Instagram I printed out, put that in. Paintings and all that. Then my YouTube page, can you imagine, 186 subscribers, and now it's 910 if I'm not mistaken. Then I spoke about my YouTube page, and I said I'm very active on Twitter as well. And yeah, so that was the end of my portfolio. I hope this has helped you guys out. I try to make it as informative and as helpful as possible. I literally showed you my entire portfolio, what I carried with me last year during my interview. I hope that was helpful. And yeah, so this is the end of the video. I hope you liked it and you enjoyed watching it. I hope you are looking after yourself and your loved ones, and take care, and I'll see you in the next one. Bye.